Good afternoon. I'm Jennifer Gerdts, Executive Director of Food Allergy Canada. May is Food Allergy Awareness Month, and this year is a very special year for us. It's a pivotal moment for the community with the introduction of a landmark bill in the Senate, Bill S-247, an act to establish a national framework on food allergy. Food allergy is not a new issue, and it's not a marginal one. In Canada, more than 3 million Canadians are affected by food allergy, including over 600,000 children. For many individuals and families at risk, this chronic disease is a daily reality that carries potentially life-threatening reactions, and it also significantly impacts the quality of life, mental health, and participation in everyday activities. Now, we have made meaningful progress. Decades of research have identified evidence-based approaches that can reduce the prevalence of food allergy and lower the risk of this disease. Early allergen introduction can help prevent food allergy when introduced early in infants' diets and maintained, and also improved diagnostics, education, and management can reduce risks for those living with food allergy. But important gaps remain, both in our scientific understanding and in how existing knowledge is applied. We know broader public awareness and consistent access to clear ingredient information are essential to keeping people safe. No one in Canada should face uncertainty about how to stay safe in everyday settings, whether that is reading in ingredient labels or relying on variable understanding and awareness of food allergy in schools, restaurants, and in community spaces. Another urgent gap is access to epinephrine in public settings where reactions occur. Epinephrine is the first-line treatment for anaphylaxis. Timely access saves lives, yet availability and policies vary widely across communities. No one should be left vulnerable because of where they live or whether epinephrine is within reach in a critical moment. Research has advanced our understanding. The challenge now, however, is that this knowledge is not consistently applied. The understanding is uneven, implementation and support across Canadian communities remains inconsistent. Right now, where a person lives can influence how quickly they are diagnosed, what information they receive, and how well they are supported in managing this condition. This is not the standard Canadians expect in healthcare or in community safety. This bill offers a path forward. It would create a coordinated national framework to align efforts in the prevention of food allergy and also in the diagnosis, management, education, and awareness of food allergy. It builds on what works, and it focuses on delivering it more consistently and equitably across Canada. We really would like to thank Senator Cardozo for leading this effort in bringing this important bill forward, and we urge senators and parliamentarians to support it as a significant step towards translating evidence into action. I would now like to introduce Heidi Hauver to provide a few comments as well.
Thank you, Jennifer. I'm here both as an adult with a food allergy, but more importantly, as a parent with a child living with a food allergy. For our family, food allergy and being at risk of anaphylaxis is something we manage every day. It affects how we prepare for school, how we navigate social situations, and how we think about simple things like eating outside of the home. Even a small exposure can cause a life-threatening reaction, and that reality means a level of due diligence and preparation that most families don't think about every day. It is an invisible burden. Unlike many children whose food allergies are identified early in life, our son's first reaction was at the age of 7, and it was a frightening reminder that allergies can appear unexpectedly and that communities need to be ready to recognize and treat anaphylaxis quickly and have access to life-saving epinephrine. These moments stay with you for a long time, and they change how you approach everyday life. What would make a meaningful difference is consistency, easy access to ingredient information, better community awareness about food allergies, readiness to respond to emergencies, and most important, the knowledge to recognize reaction and access to epinephrine to treat them. This is why a national framework matters, ensuring families like ours have the same safety, understanding, and support across the country as every other Canadian. I'd like to give Sullivan the opportunity to come in and say a few words.
My name is Sullivan. I'm 9 years old. I have food allergies. Kids like me have to think about food all the time at school, at birthday parties, even when I go to a friend's house. I have to ask lots of questions, but sometimes I still feel unsure. It would help me if everyone knew more about food allergies so I didn't feel different and worried about what might happen to me. Mostly, I just want to be able to do normal kid things without being scared. It would make a big difference if I knew I can get help if needed, and to feel included with the world around me.
Great job, Sullivan.
Thank you, Sullivan. All right, now I would like to ask Senator Cardozo, our champion for this this wonderful bill that he's brought forward, to make a few comments.
Thank you, Jennifer Gerdts. Thank you, Heidi Hauver, and especially thank you, Sullivan. You're a star. You're good at that. How about a fist bump? Well done. I'm pleased to be introducing this bill, Bill 247, to create a national framework on Food Allergy Act. Bill 247. We're going to have to remember that number for a few months, a few years, but it's going to be a good number that we're going to keep in mind. Really pleased to introduce this bill because it responds to a clear need I've seen both personally and through experiences of Canadians across the country. This bill brings a coordinated approach to prevention, diagnosis, education, and management across the country while respecting provincial jurisdiction. It is core. It is about ensuring that evidence-based practices are more consistently implemented so Canadians across the country can expect a similar standard of care and safety regardless of where they live in Canada. It is also about prevention and system performance. Severe allergic reactions are traumatic for the individuals, first off, but also for the families, and are largely preventable with the right supports in place. When those reactions do occur, timely access to epinephrine is critical. Strengthening awareness, preparedness, and access helps reduce avoidable emergencies and supports a more efficient healthcare system. Just as importantly, there are still research gaps we need to address. This framework does not replace that work. It helps ensure what we do already know is used effectively while we continue to advance what we can still need to learn. I will be urging my colleagues in the Senate and the House of Commons to support this bill, to discuss this bill, to debate it and discuss it with their constituents across the country. Canadians expect us to act on what the evidence already tells us. Together, this is an opportunity to turn strong knowledge into coordinated national action that improves safety and quality of life for all Canadians living with a food allergy. Thank you, and we're happy to take questions.
Merci, thank you. We don't have any questions at the moment. Il n'y a pas de questions pour le moment. Is there something you would like to add to your statement?
I don't think so.
That's good.
Thank you. This concludes the press
Sullivan,
conference.
do you want to add anything more?
I'm okay.
You're good, okay.
Thank you.
The star of the show. Thank you very much.
This concludes the press conference. C'est ce qui conclut cette conférence de presse.
Merci.